I am hearing the chimes on the Old Main bell tower, which means it's 9 o'clock in Happy Valley and time for another edition of the Penn State Alumni Association's Coffee Hour. I'm Paul Clifford. Welcome everybody in. We will be getting started in just a minute or two. As always, we want to know who you are and where you're zooming in from today. Go ahead and drop that information in the chat on the bottom of your Zoom video window, or if you're watching us on Facebook Live, which I see we are now streaming on, go ahead and drop that information in the comments. We'd love to welcome you into Coffee Hour this morning. We have a great program lined up. We're going to be talking with Gene Woods. Gene is the president and CEO of Atrium Health in Charlotte, North Carolina. And we are looking forward to our conversation with him. It is good to see so many familiar names here on Coffee Hour. I see our friend Jim DeLark down in North Carolina and Dave McClung tuning in an early morning in Billings, Montana. Julia down in Huntington Valley, Pennsylvania, and Lisa in Chapel Hill, North Carolina. Welcome everybody into Coffee Hour. We'll be getting started in just a minute or two. Thanks for joining us. Jamie Foster in North Carolina and John Thompson in Washington, D.C. Welcome to Coffee Hour. Craig in Erie, Christine in Maine. Welcome in. From Maine to Montana so far this morning, and probably points beyond. I'm waiting for Mazatlan, Mexico to tune in. We usually have a guest down there, and when we say we are and Penn Staters are everywhere, that's certainly the case, as evidenced here on Coffee Hour. We see the wide array of people zooming in to hear the good news of what Penn Staters are doing to have an impact in their community and in their professions. I see Nicole Callahan, first time to Coffee Hour, looking forward to it. She is a 2000 grad living in New York. Welcome to Coffee Hour. A lot of pressure now in New York. Nicole, I hope I don't disappoint with your first ever zooming in here for the program. I think we have a good show to kick off for you with Gene Woods joining us. Where else would you rather be than a Zoom full of Penn Staters? I'm Paul Clifford, CEO of the Penn State Alumni Association, and welcome to the association's Coffee Hour. Each week, you can expect to hear the voices of Penn Staters talking about what they're passionate about, and you can expect to feel the pride and the power of the Penn State network. We are recording this session as always, and closed captions are available for this event. You can find that information in the chat in Zoom or in the comments on Facebook. Well, like I said, we have a great guest lined up today. You see him on the screen already with me. Gene Woods is the president and CEO of Atrium Health, a nationally leading nonprofit health system with more than 70,000 team members serving patients at 42 hospitals and over 1,500 care locations across 4 states. With nearly 30 years of leadership, Gene has served as president and CEO of CHRISTUS Health, where he oversaw operations in US, Mexico, and Chile, and as both the SVP and CEO of St. Joseph's Health for Catholic Health Initiatives. Wood's career is decorated with many honors, including number 7 on the 100 most influential people in healthcare. We're going to ask who the 6 people were ahead of him later, and what kept him from being number 1, as well as being a top 25 minority executive in healthcare by Modern Healthcare. He's the recipient of the Charlotte Business Journal's 2020 Business Person of the Year, one of the 100 Great Leaders in Healthcare by Becker's Healthcare, and I know an award that he holds dear to his heart. He was a 2016 Penn State Alumni Fellow. His service includes time as chairman of the Board of Trustees at American Hospital Association, as well as recent appointments to the North Carolina Council for Healthcare Coverage, Governor Cooper's Economic Recovery Task Force, and the Social, Economic, and Environmental Health Equity Task Force. He holds a bachelor's in health planning and administration, a master's in health administration, and an MBA, all from the Pennsylvania State University. Welcome to Coffee Hour, Gene Woods. How are you this morning?
Oh, I'm doing great. It's great to be with you today.
It's fantastic to see you. Let's start at the very beginning. How did you become a Penn State Nittany Lion?
Well, actually, my father was in the Navy, and we ended up, and I could talk about moving from Spain, where my mother's from, to outside of Philadelphia. And actually, when we got there, a couple of years after I went through grade school there, when I was looking to college, my parents had split up, and I knew I needed to stay in the area. And so I looked up the nearest the school that I knew and that was Penn State, and actually was in Abington, Pennsylvania at the time. It was called the Ogons campus, so it was a branch campus. And so I applied. That was the only school I applied to, Paul. And so if Penn State would not have accepted me, I wouldn't be here speaking with you today.
Well, we're glad they did, and we're glad you are here with us today. When you were a student at Penn State, what were some of the things that you were involved in?
Well, one of the things that when I went to State College, there was actually the co-founder of the Health Planning and Administration Department was Dr. Stanley Mayers. And he encouraged me from almost day one to run for the club president of what we call the HPA club. And that was really, and at the time, he was telling me that he felt that there was opportunity to continue to build bridges between students and faculty. And that was my job description, if you will. And so we would host, I ran, was elected, and we would host, these faculty student interactions just to kind of share opportunities to continue to learn together and things of that nature. It was more a forum for dialogue, and actually really built some strong connections there. So that was something that shortly after getting to State College, I was involved in. And obviously, most of my spare time, other than studying, was spent playing in different musical bands throughout the different clubs and bars in State College area.
Absolutely. Well, we're going to get to some of that because those are some fantastic stories that I can't wait to hear. But when you think of some of your favorite memories, I'm sure it's back to some of those times, either playing in the tailgate lots or playing downtown. But some of your favorite memories of your time at Penn State.
Yeah, one of my most famous favorite moments was actually we played in this band called Stolen Hours. We talked about that at the regatta. And so the Penn State Regatta, there was about 30,000 people there. And we actually opened up for Joan Jett, the one that I'm remembering. And I just remember it being a gorgeous day. We're up doing the college thing, playing rock and roll in front of all of these fellow students. And it sticks in my mind to this day. I would say the other memory, obviously, is when I was the first one to go to college in my family. So when I received a dual master's degree in master's in business, master's in health administration. Just the proud look on my parents' face that their son may have finally made good, if you will. And then I would say another just really great moment was, and this is after I left and went back for a game, and I was there for Paterno's 400th win against Northwestern there, big whiteout at night. We could have been there. Nobody wanted to leave. We could have been there till 2 o'clock, 3 o'clock in the morning. There's such an energy in the stadium. So those are some that come to mind.
That was a fun night. It sounds like you described the regatta and you playing an opening for Joan Jett. It sounds a little bit like Woodstock without the rain. 30,000 people and just a great open field. Martha Wilson, who is one of our members of the audience, was actually in the audience that day and remembers seeing you play.
Oh, wow. Wow, that's incredible. And that was also before the days of social media and everything like that. So right. It was sort of, well, thanks for remembering. Hopefully we were as good as I remember we might have been.
This is the Penn State Alumni Association's Coffee Hour. I'm Paul Clifford. I'm joined by Gene Woods. He's the president and CEO of Atrium Health. So Gene, you mentioned coming to Penn State, right? Starting at the Abington campus. When did you know that healthcare and running health systems was part of your future?
Well, it's interesting. I went, some of my friends grew up knowing that wanted to be lawyers or doctors. Nobody ever grows up wanting to be a hospital administrator, right? Nobody really knows what that is. And so when I was at the Ogons campus, Abington campus, there was a career day that I thought I wanted. I'm fluent in Spanish and I like business. I thought I was going to do something in international business, and I got the days mixed up. So it was actually a local hospital administrator at the Abington Hospital talking about, what a wonderful career this was. And it really, as I say, he had me at hello, because, this is an opportunity. Healthcare was going through such dramatic change. And he was saying, we need some bright young minds that are committed to community and really the transformation of the field. And I said, okay, I'm in. And that's sort of how I got started.
So in 8 years, you went from Penn State to your first CEO role as the CEO of Schneider Hospital in St. Thomas in the U.S. Virgin Islands. First of all, that sounds like a horrible gig, having to go to the Virgin Islands, but that's a fast rise to becoming a CEO. What do you attribute your success to, and how that opportunity came by so quickly?
Yeah, well, there's a fair degree of humility, because a lot of times things open up for you, and you're blessed to be there at that moment to have a career opportunities. I would say there's a couple things though. I felt that at the time nobody could outwork me. I mean, that work ethic to me has always been something that's been core, and I'm proud that I got 2 boys and they have maintained that strong work ethic. I do believe that I've always had an ability to, for lack of a better way of saying it, see around corners. I call it on the fly scenario planning. A lot of what I do is strategy and contingency planning and things of that nature. And that's sort of something that I felt that I had for since I entered the field, if you will. But also, I think I grew up and I had a roof over my head, and we were fed and things of that nature. But I remember what it felt like not to be able to pay the electric bills at the time. So I think the ability to really talk to people, meet them where they're at, whether there's the environmental service worker that's really keeping patients safe by keeping the room safe, or the governor, I think is something that I've always felt comfortable with.
Well, we're going to talk about crisis planning. We're going to talk a little bit about being able to see around corners. I'm sure that's been a big part of your life for the past 15 months. But I want to get back to the role of music, because I think that's a fascinating part, not only of your time at Penn State, but has been kind of a through line through your life. Talk about the role of music in your life, and how that's helped keep you balanced, from your creative side and your professional side.
Yeah, it's always been a central part of my life. When I grew up, my father was, if he wasn't an aeronautics mechanic in the Navy, he would have been some great blues singer in a band somewhere. Because ever since I was a kid, he'd be playing blues albums, Albert Collins, B.B. King, Bobby B. Blue Bland. And then my mother's side, being Spanish from southern Spain, those flamenco was always playing in the house. So I grew up with sort of music in my DNA. And I picked up a guitar when I was in 5th grade. And my uncle showed me a little song, and I was hooked right then and there. And so it's always been part of who I am. There's something about being able to express especially as a young man, express your thoughts and write a song, and then record that song or play that song live in front of a packed house. That's always been something that's kind of given me energy. But I would say the other thing is, in terms of what I do professionally, there's a strong need for right brain thinking, right? And that creativity that I think it comes, that's required part of my gig, if you will, comes from that music side. I think, where you're always improvising, you're always having to listen to your other bandmates, if you will, and then come up with something new. And so I think it's also served my professional role as well.
Absolutely. You've mentioned Spain a couple of times, and your mother, and growing up at the naval station there. Talk a little bit about that influence on your life, and kind of take us back to the naval station and what it was like to grow up there.
Yeah, my father grew up in this little rural town in Western Tennessee called Yuma. Nobody's probably heard about it. And so he joined the Navy and ended up eventually in southern Spain at the base there, and met my mother, and they got married, and then had a chance to move back when I was 4 years old. So I spent 7 years of my childhood in Spain. My mother is the oldest of 12, and I'm the first grandchild of 37. And what I remember as much as anything is my father was he had the best barbecue sauce and ability of anyone. I'm still trying to see if I can come close. But so we would have, a couple of times a month, we'd have this, all our family together, 30, 40 people just doing barbecue. And it was really a wonderful upbringing because we would live on the base, but then we would go to Jerez de la Frontera, where my mom is from. It's about 10 miles away, and hang out in this beautiful old Spanish city, if you will.
That's amazing. You're going to have to go over to like Millwood or maybe Sauceman's in Charlotte, where I know you live, and check out their barbecue. See if that compares at all. Yeah. I know it's a different kind of barbecue that you're talking about, right?
Yeah. I think my father's up here, and everything else is second. Just like my mother is a great cook, and her paella is always number one, and everybody else is second. So I grew up eating some great food, but from very distinct cultures, if you will.
Can you imagine? I'm just trying to imagine the large family meals, 37 grandchildren, 12 siblings around the table. That's probably some great family memories and great family meals.
Yeah, lots of in Spain there's a concept called jaleo, which means noise and craziness. And that's if you take my Big Fat Greek Wedding, that movie, right, well, just instead of Greek, just replace Spanish, and I think you got a good sense of what my family is like in Spain.
We just watched Lin-Manuel Miranda's In the Heights. And so that's kind of what I'm imagining is kind of a lot of conversation going on around the table around some amazing food.
Exactly. And, when there's football games, we call football or soccer,
right?
Real Madrid, Barcelona, there was this mayhem in the house, if you will.
Absolutely. So let's stick with the music. I want to get to the healthcare side because I know a lot of the people tuning in have some questions about that. But I want to give you the opportunity. Tell us about Stolen Hours. Tell us about Soul Gypsies and your time at Penn State in the music scene.
Yeah, well, I think when I was at Penn State in total, I was in maybe 9 or 10 bands during my time there. But early on, there was this guy, J.R. Mangan, and he was in a band that some of the audience may recall during that time called Space Goop. They did a lot of Grateful Dead type stuff. They were a fun trio. And he was leaving his band, I was leaving mine, and he called me and said, "Why don't we start something?" And so there's a bass player that he knew called T.G. Crane, a drummer, Kerry Statlander, and J.R. Got us our gig, I think a month after we get together at the Cafe 210. And so we were locked down in the basement trying to learn a couple of sets for that gig. Fast forward to today, J.R. Mangan, who was the lead singer and the acoustic player for the band, owns the Cafe 210. Right, so so it's just a really interesting connection. But that was and we ended up recording an album and things of that nature. So it was a fun classic rock type band. And then Soul Gypsies was really a homage to the music I had growing up, which we had, I think it was a 10-piece band. We had 3 horn sections. We had backup singers. We were doing sort of the old soul, R&B, Otis Redding type music. And it was really mostly originals that I had written. So that was sort of a completely different thing than Stolen Hours, but we had a lot of fun, and I had a lot of fun playing at Penn State after I got my studies done during the day and the nights and the weekends.
Absolutely. And now, and maybe I have this, I hope I have this story right. You've just started playing more publicly in 2000, things going on in the world, your song, Not Enough Joy, you've started to perform that publicly. Talk about what inspired you to take the Fender out of the house and maybe start playing in front of people again.
Yeah, well, this has been such a hard year on everyone, especially frontline caregivers, and I obviously an organization of 70,000 people that have been all in every single day, 365 days, and so we knew that we typically do a talent show every year, and if a talent show, I mean, we could compete with folks from American Idol, the folks that we have here, and in a normal year, we would do it at a big downtown theater and really pack the house with 1,200 people and then have a show. Well, this year, obviously, we couldn't do it in person. And so some of my team said, well, there's really a need for people to express themselves. So there's and really do something different than COVID all day, all night. And so there's a Grammy Award winning studio in Charlotte called GAT3. In fact, the Babies album was recorded there and was one of the record of the year. And so I said, well, why don't we just do something different? Why don't we have the 12 finalists do a record at GAT3, and then we'll publish a video and we'll share it with certainly our 70,000, but maybe people wanted something to do on a Friday night. And as part of that, they asked me to do a song, and I actually remembered a song that I had written when I was at Penn State when I was about 21 years old, called "Not Enough Joy." After I saw this documentary about Africa, this war-torn city in Africa, and it just I don't know, it spoke to me at the moment. And my first words that I wrote is, back then when I was at Penn State was, when one brother is in chains, we should all feel the iron. And when one sister burns with pain, we should all feel the fire. And it really seemed like what was real back then was something that spoke to the moment. And so I did a video, you referenced it, "Not Enough Joy." And I think surprising to me, I think it's got 14,000 sort of hits pretty quickly. And it was my way to come out, if you will, say, okay, I've got this other side too. I think people really wanted their leaders during this time to be as authentic and real as can be. And I think that connected me with the organization and, quite frankly, the community in a different sort of way.
Yeah, absolutely. Absolutely. Well, look, I think the song got so many hits because it spoke to so many people in a really relevant way, right? I mean, a lot of people felt, the lyrics of the songs were expressing kind of what they couldn't express themselves, right? What they were feeling, right? Why do I feel so connected to someone else who's getting who is being abused, right? Or doesn't have the same rights that I do.
Right.
And it's because when one suffers, right, we all suffer.
Exactly.
I think that just spoke to a lot of people.
Yeah. I think so, and it's such a timeless message, right? Is essentially we're all in this together. It's certainly something that was the case when fighting COVID, and we're still fighting the pandemic. But it was also fun to do, because now I realize there's so many other folks that I know that have these hidden talents. Some painters and writers, and we should all have permission, I think, to bring our whole selves to work and to what we do. And I think that's something that hopefully resonated with some folks.
Absolutely. Some great messages coming in to us as the panelists on the chat. Kate was at the regatta. She remembers seeing you play there.
Wow.
Steve Wagman. Steve is a member of the University Board of Trustees. He's a past president of the Alumni Association. He says, great to see you. One of these days, he needs to get down to Atrium Health to meet you in person. Your early days in healthcare kind of run in parallel, and then you took different paths post-graduation. Steve is the national healthcare leader at Siemens. And so he's doing some great work in healthcare. He has a question for you, actually. Sure. He wants to know if you can elaborate on how Atrium is dealing with healthcare disparities in local communities that Atrium serves.
That's a great question, and I look forward to meeting you. I think you may know we do great business with Siemens. Early in the pandemic, this was back in April. We have this ability to really we have great analytical capabilities, and we can hotspot exactly what's going on in the different neighborhoods down to the zip code. And what we realized in Charlotte, for example, there were 6 zip codes that were having disparities in testing. And we knew that was going to be a problem. So almost immediately, my team put together a plan. And within a couple of weeks, we had these roving vans that would go to the communities, would go to church parking lots, would go to the YMCA parking lots. And we without, everybody can walk up. But you remember back then, testing was such a hard thing to come by. And we went to these communities and eliminated the disparities in testing within a matter of weeks. And so proud of that. And we worked with the church leaders and the community leaders. We were also on construction sites. We have a lot of Latinx workers with all the constructions going on here. So we went to where they were. And also, we then used the same playbook, if you will, for vaccination that we're currently doing now. We're working with church leaders and so forth. And I think I'm very proud of playing a leadership role in helping to reduce the gaps in care that exist in too many of our communities.
So a number of questions coming in from the audience. Jade Honey mentions you were the CEO the COO at MedStar for 4 years. In your opinion, What are some of the most important skills to have as a chief operating officer?
Yeah, I think the running operationally running a health system is like running a small city. So, and you're not only thinking about strategy, you're thinking about finance, you're thinking about where policy is going. So, but I think fundamental, this is a people business, and so the ability I referenced it earlier to be able to connect with folks at no matter what levels they are, and really listen and really work together and collaborate, all of that, which is basic 101 is really, really important when you're in healthcare, and connecting with community, because a lot of times when I first started, it was all about what, as administrator, what happened inside of your walls. Right now, my job is as much what happens outside of my walls as inside, and so the ability to connect with communities, lawmakers, and things of that nature is fundamental to being successful, I think, as an operator or a leader in healthcare.
Let's take a step back and look at it from a 30,000-foot perspective. What are some of the biggest challenges facing healthcare in the U.S. today?
Yeah, I think, well, we just alluded to it. I think there's still tremendous disparities in care. And I think that's something that we have to continue to address. We saw it during COVID, where Black and Brown neighbors and were dying at up to 6 times the rate. And I think so we have to continue to focus as a nation to eliminate the disparities of care. A lot of that is due to what's called the social determinants of health, which is just housing, it's food, it's transportation, so it's infrastructure needs. And I can't tell you how many kids we have given meals for free, because especially during the summer, some of the kids that go home on Friday from school then are worried about their meal until Monday when they get back. So all of this inequity and social determinants, I think, is fundamental. I would say also, we need more people to be insured in this country. The Affordable Care Act insured about 25 million. There's still about 30 million right now that are uninsured. So the ability to really make sure, as one of the most powerful nations in the country, that's critical. Including Medicaid expansion is really, really important to make sure that people have the insurance that they need to access care. And then finally, affordability. I think we're all focused on making sure that healthcare can be more affordable.
So you're a vocal activist for social justice and equality. I mean, you can hear it in the answers to the questions. How much change are you able to affect from the CEO position as one of the largest health systems in the country in terms of access for care for all? You seem you kind of uniquely positioned than maybe other healthcare systems might be.
Yeah, tremendous abilities. The Atrium is, I've been in the field for 30 years. It is the best platform. And I'm maybe speaking from a biased perspective, but I can tell you the best platform really to transform how we deliver and how we impact social issues in our communities. And it starts with my board. My board chair is this gentleman named Ed Brown, who also helped Hugh McCaw build Bank of America, and also ran Hendrick Motors for he just retired for almost 14 years. He and the board are passionate about this work. And in fact, every single committee that we have in the health system has a social justice part of their charter, from HR to finance, all the way through. And so I think the ability to have, the third thing I would say is the team that I have is so motivated by doing this. So our mission is to improve health, elevate hope, and advance healing for all. And that for all is a really, really important part of our mission. And so I've got an energized team that says, let's go to communities, let's go tackle this. I think with that, certainly in the communities that serve, we've been the predominant voice and action leaders, if you will, in dealing with the needs of the community. But then when I was chair of the American Hospital Association board in 2017, I was able to use that platform really to have a national equity pledge. So I think over 2,000 hospitals signed on to, how do we collectively eliminate disparities of care.
So earlier in our conversation, you talked about some of the skills that you have that helped you to rise to become a CEO and a leader in healthcare, being able to see around corners, planning for crisis. Can you talk a little bit about the last 15 months and COVID-19 and one, how you were prepared for that crisis, and two, maybe some of the things you might have learned for the next time we face something like this that you may do a little differently?
Yeah, well, we're an organization that whenever there's any hurricanes or tornadoes or anything like that, we have we're the ones in the Southeast. We actually have a mobile hospital. We go to these areas of emergency to lend help, working with FEMA and others. So, we're used to responding to disasters. And I always say when people sometimes have to run away from them, we're running towards them. Nobody was prepared for COVID, as we know. And so I remember gathering all the senior leadership when we knew that this was going to be something that we were going to deal with for a long time. And I said, none of us have dealt with this before, but I trust that each of our individual experiences that we've had up to now, if we tap them the right way, if we work together in new ways, that we're going to work through this. And so we learned a number of things. One of the things is agility, right? I remember when we were running out of hospital beds, and we thought it was going to be a matter of weeks. And a group of my clinicians and scientists came to me and said, "We got a plan. How about we start caring for patients in their homes?" We have the monitoring equipment. We have, medics that can go into the home. We have the data, the telehealth capabilities. And so within a matter of weeks, we had hospital at home. And we were treating COVID patients at home that met certain criteria, and then beaming in multiple times a day through our telehealth capabilities. We've seen, I think, about 80,000 patients now at home. And so it's this ability to really assess the situation, mobilize the team, and respond, even though none of us have dealt with this before, that I think really helped power us through. And then also we built some phenomenal relationships with the government and also business community. For example, when the vaccines were first approved, there was a lot of issues in terms of the distribution. And so one of my neighbors is the CEO of Honeywell, and myself, Darius, the head of the Panthers, North Carolina, the Carolina Panthers, and then also the head of the Motor Speedway, we got together and we held some of the largest vaccination events in the entire country. We had shots in arms every 4.5 seconds, and we were vaccinating 20 to 30,000 people in a weekend. And so that collaboration and that business to government to health system collaboration, I think, is something that we've built some very, very strong bonds that will serve us for whatever the next version of COVID is, if you will.
Absolutely. To that point, Dr. Mike Yangovic is on today. He said, before I knew about Gene being in Charlotte, I was marveling at Atrium's excellent vaccine rollout response. Better than I can imagine, and much better than I was hearing around the country. It's good to have another great Penn State grad in the Charlotte area. So that's from Dr. Mike. Dr. Mike Yangovic down there, also in Charlotte, praising your rollout.
Great, thank you. I mean, I think the orientation we had, you were hearing that people that were our parents, 70, 80 years old, waiting in lines for 4 hours and 3 hours and in the rain. We said, that's not going to be us. We're actually going to get them in and out. And again, what we want for our own parents and loved ones is what we wanted for the community. And so proud of the team for having delivered on that.
Absolutely. A lot of great questions coming in that I want to get to. Jim DeLark, a good friend of the Alumni Association living down in Charlotte, has a question. And look, I told you off before we were live, I lived in North Carolina for 10 years. And so I know this question that I'm about to ask is more about politics than it is about healthcare. But Jim wants to know, tell us about Atrium's role in bringing the medical school to Charlotte and the expected impact of the school on the community. I know the impact of the East Carolina medical school, and I know Chapel Hill has a medical school. I know how kind of there's kind of a defensiveness around growing that medical education in North Carolina. How did you play a role in helping that come to Charlotte?
Yeah, I am so excited about the medical school that we're building in Charlotte. It will open up in 2024, and it really came about through we're in a partnership, a strategic combination with Wake Forest University, Wake Forest School of Medicine, and the system there. And we actually received the FTC approval back in October. And as part of that, we said, we've got a wonderful School of Medicine, the Wake does, in Winston-Salem. And we thought that Charlotte was the largest city in the country without a medical school. And so that was part of what the initial thought was, even in coming together, is can we have a second medical school in Charlotte? I got to tell you that the response from the community has been overwhelmingly positive. I mean, everybody's so excited about this. And this will be one of the first medical schools that actually is built in this post-pandemic phase. So we're able to build in all the learnings from the pandemic, how we do telehealth, how we engage with community into the curriculum. And I think there's a lot of excitement about what it's going to do for certainly Charlotte and the region, for our partnership with Wake, but the state of North Carolina as well. And our goal is to with all the shortage in physicians that is anticipated, we want to continue to grow our own, but we also want to make sure that the class and the pipeline is diversified. Right now, I think there's about 6% of the physicians in the country, for example, are African Americans, and the overall population is 13%. So we've got a delta to make sure that we're having growing and the next generation of clinicians in a way that also reflects the communities that we serve.
Absolutely. Yeah, we know medical schools and teaching hospitals are probably more focused on the service aspect and the community health aspect than maybe other hospitals are. And so that it's just going to have a tremendous impact there for people in Charlotte.
Exactly. And also research. I mean, we know that the vaccine, what normally would take 10 years, took a year, and we're going to build an innovation district to complement the one that we now have in Winston. And we're going to be able to generate new cures, new devices, and really have the talented scientists and clinicians working together side by side with medical students to actually enter into this brave new world and be one of the organizations that actually help shape where healthcare is going.
Couple questions coming in the space of advice for people looking to break into health and hospital administration. So let's start with that high level one. Someone maybe a junior, maybe a rising senior here at Penn State looking to get into hospital administration. What's some advice for someone trying to break into that industry?
Yeah, well, there's a lot more options, I think, today than when I graduated. When I graduated, the track was, if you want to be in operations, pretty much just find a hospital and try to get an internship and go. But there's just, with all the health tech. And so I think the first thing is find out what it is that you want to do within this broad. Do you want to be working more outside of the hospital, inside the hospitals? There's insurance, there's tech, as I mentioned. And I think and what I would just say simply is what I did is just go talk to somebody that's doing something that you think you might want to do, and ask them, what is it, what do they like about it? What are the challenges are? I think that begins to shape and also builds relationships. I'm a big proponent in those situations and I used to do that, is just say, I just want an informational interview. I don't expect anything. I don't want a job. I don't want an internship. I just want to learn. And if you take, I can buy you coffee for 30 minutes. Tell me what you do, and that forms connections. You never know where those connections can lead.
Absolutely. Jeff has a similar question to that. I know, as I mentioned in the introduction, you have 2 advanced degrees from Penn State. What are your thoughts on healthcare providers obtaining advanced degrees such as the MBA or MHA to gain skills to better meet challenges of healthcare leadership?
I think it's really important. That's for me, it was very foundational. I got my MBA first at Penn State because at Smeo College, because I knew that the healthcare was really going to have you're going to have to manage big businesses, right? So my system right now is $12 billion. And so the ability to really understand how to run a business was important, but also policy, health policy administration is in healthcare is very specific to the sector. So I think the blend between knowing business and then also understanding the policy implications of what happens in state capitals, what happens in DC is really important in terms of the effect that it has on local communities. So understanding how that all works together is really important. So I think the dual masters that I got at Penn State were a great foundation to the career that I've had.
This is the Penn State Alumni Association's coffee hour. I'm Paul Clifford. I'm joined this morning by Gene Woods. Gene is the president and CEO of Atrium Health. A couple questions coming in. Dave Jablonski wants to know, when you face issues with low morale in the workforce, especially in healthcare, and look, we know our healthcare workers have been on the front line doing a lot of heavy lifting. How do you approach that and make sure that the morale of your team remains at a level where the quality of care remains high? And how do you connect people to make sure that they, you mentioned earlier how important collaboration and teamwork was to being a member of a band or leading an organization. How do you keep people connected and the morale high so that productivity and teamwork continue to thrive?
It's a really important question. And I got to tell you, we've been at this for 15 some odd months, and the team continues, to be engaged in the trenches, and it really wore on a lot of folks. And I think some of it is as simple as I spent a lot of time just recognizing and catching people doing great things, right? So I would walk the halls of our COVID units and just really recognize people and talk to them and seeing how they're doing. Some of our employees, we call them teammates that got COVID, I would call them at home to see if there's anything that we could do. So it's this personal touch, this one-on-one check in, that's really important. The other pieces of it that we really work on every single day is how do we make the care environment easier for like physicians? If you think about it, physicians have to not only care for patients, but they're dealing with all of these IT requirements, all those regulations. So we really had focused a lot on reducing, let's say, the number of clicks that they have to care for a patient and going into computers. And so if we're excited that we're creating quite the environment. We've got a lot of physicians that are joining us in the middle of this, that because they feel that's a special culture. But I would say during COVID, when there was a lot of other systems that for their own reasons had to lay off people and furlough people, we did not. We kept people whole through this because we never have experienced anything like this. And we knew how scared our teammates were for their families. And so we had to retrain a number of them, in the middle of this, but I think they knew that we had their back while they had our patients and communities back throughout this pandemic.
One thing we didn't talk a lot about before the pandemic that I think leaders are thinking about now more than ever. And Dave McClung from out in Billings, Montana, a great volunteer for the Alumni Association, reminds me of this. And I'd love to get your perspective on that. We didn't talk a lot about the resiliency of our workforce before the pandemic, but now we have learned and discovered so much about our teams and how resilient they are. What are your thoughts on how to build kind of our resiliency capacity? And so that we are even better prepared next time around for whatever the next challenge might be, for whether it's a hurricane or a tornado or another pandemic. How important is kind of building resilience capacity to you and what you're thinking about as a CEO?
Yeah, I mean, those are all really good questions, and it's a multifactorial sort of answer. I do think that especially working in healthcare, people want as much control over their environment and voice in what happens as they can have. And so, there's a lot of listening that occurs. We have a lot of ways of doing that: forums, one-on-one surveys, and things of that nature. So we've really tried to make sure that we were hearing what the frustrators are, what the barriers are, and try to remove as much of that. That's I think that's fundamental. One of the things that, and I mentioned that before, recognition is I'm part of the baby boomers, right? So I have a whole a stack of cards over the years that a CEO or a colleague has sent and saying, "Great job," and you don't know how important that is in the middle of that somebody recognizes that. So now it's e-cards, and I think we've sent over the past year and a half like 300,000 e-cards to each other. I say, thank you. So that is part of the culture that does, interestingly enough, build resilience, because people feel like they're acknowledged. But here's one thing that I instituted when I was here, when I came here 5 years ago. We call it connect to purpose. So every single meeting that we have, whether it's a board meeting or a staff meeting, we start by telling a story of something we did really well for a patient or another employee, another teammate. And it sort of it reminds people of the meaning in work. I mean, people want to find meaningful work. And I think this connected purpose, starting every meeting, sometimes it takes 5 minutes, 7 minutes, but it just grounds every discussion we have, whether it's strategy or how we're going to engage the community. I think that's been a powerful way to continue to build resiliency in our team.
Absolutely. We talk about, we start a lot of our staff meetings at the Alumni Association with how have we fulfilled our mission this past week, right? And it keeps people focused on what the mission is and how to connect the work directly to fulfilling that mission. I think it's an important reminder to keep people focused on kind of the purpose and nobility of the work that we do.
Exactly.
So Tom Mary, this is more of a comment than a question, but he wants to know who rocked the regatta in '87 more than John Cafferty and Stolen Hours. So again, Stolen Hours getting some.
I can't believe people remember, that's actually really cool.
Another great shout out here from Colin Good with a question follow up. Thank you for taking care of my Aunt Fran, who survived COVID at your hospital after a 5-month stay, 3 months in ICU. So Colin is appreciative of how you're taking care of their loved one. How is Atrium Health managing mental health care? You know, we all hear so much about kind of the virus and curing the virus and preventing it. But then there's also the mental side that we need to continue to focus on. How is managing mental health care part of what Atrium does?
Yeah, and I got to say, and I think it's implied in that question, you know, mental health crisis is a crisis right now in this country. And we actually we're one of the few health systems that still have behavioral health hospitals. So we actually have 2 where we care if somebody, so we have emergency psychiatric capabilities. But I think what's one of the things that's really helped us well is this telehealth platform that we've built. We've had this for over a decade. And we actually now can beam into a physician's office. So if a patient might come for cardiac problems, let's say, to a physician, and also the physician might realize they also are dealing with some mental illness or behavioral health issues. And so we're able to have immediate access by our psychiatrists or our teams helping at that point of care. And so when that patient leaves, they not only have their heart meds, if you will, but they may also have, if they need, their behavioral health meds. And so that's really helped with compliance, actually managing heart disease, diabetes, and things of that nature. So it's a really big component of what we do and who we are. But again, I think there's a lot more work to be done by everyone to make sure that, and 1 out of 5 in this country are dealing with a mental health issue, behavioral health issue. And so I'm sure everyone in this call knows someone that's close to them. So I think there's an opportunity to continue to increase funding, and we're on the front lines of this every single day, including with our own teammates.
So we know about the impact that COVID-19 has had on the healthcare workforce. And as we come out of this, right, we already know that there were certain healthcare positions that were already kind of underemployed, right? Nurses, there's been a shortage of nurses for a decade in this country, right? Talk about what you're thinking about in terms of the potential staffing crisis in key healthcare positions as we come out of COVID-19 and other people are making kind of different career decisions because of that.
Yeah, I think it's a real challenge. And we, again, during this pandemic, we realized what shortage we had in certain areas. It's one of the reasons why we're building a medical school, but we also train allied professionals. We train nurses and other professionals. So, our philosophy has been grow our own and then keep as many here in our system once they graduate, because it's a real thing. And to your point, we've got a lot of nurses that just did such phenomenal work during COVID and continue to, and are just tired. And some of them are choosing, maybe I'll try something different. So that could exacerbate the shortage. And it's something that we keep top of mind every single day.
This is the Alumni Association's Coffee Hour. We're talking with Gene Woods. He's the president and CEO of Atrium Health. Also a rock star from Stolen Hours and Soul Gypsies. You might remember him from your time here at Penn State. I want to talk, kind of switch the conversation back and maybe have a little bit of fun here at the end. First, what's next for you musically? Now that you have started to perform publicly, it seems like you've maybe caught the bug a little bit again, and that you want to be in front of audiences, kind of sharing your craft or your creativity. What's next for you?
Yeah, well, the thing that's helped my own mental health, as you mentioned during the pandemic, was every once in a while I was able to steal away and go to this music studio. And actually, what's next for me is we just finalized the recording of a 15-song album that of my originals, and we had some amazing players on it. The drummer from John Mayer is my drummer on it. One of the trombone players that ran James Brown band for 10 years, he's on it. Sax player for Prince is on it. So I've got these all-star cast of musicians, and we're finalizing that, and hopefully by the fall we'll be able to release the album. Now, I am a bit old school too, so not just CD. I want that double album set, and on vinyl, which I think still sounds better than CDs or streaming. And so part of that in the fall, and I'm open to raise some money in selling this to help causes that I believe in, including our healthcare heroes. And so that's the big thing that's next. I'm really excited. It's in the mixing phase now, and again at GAT3, which is a Grammy Award-winning studio, and that'll be a fun project.
That's amazing. I mentioned in the intro that you were named the 2016 Alumni Fellow by Penn State. Talk a little bit about what being recognized for the impact that you're having in your career by your alma mater means to you.
Yeah, well, Penn State was one of the most formative times in my life, not just from an education perspective, but also the connections that I've made, the memories that I've had, and so to be recognized that, and obviously it's a big school with many alumni, was quite special, and most special of all to have been there with my boys in the audience, and really letting them know that hard work can pay off, and education is important. This is another way to reinforce that. And also Dr. Stanley Mayers was there, who again was the head of the health planning administration department when I got to Penn State. Really put his arms around me from day one. He saw something in me, and he just went out of the way. So to actually receive it while he was in the audience, it was extraordinarily special.
Well, we like to have a little bit of fun here on Coffee Hour, what we call our lightning round. So I have just a couple quick hitter questions to throw at you, and see what your responses might be. So first, what is your favorite song to perform?
Actually, well, I guess it's changed over the years. And other than my songs, the one thing, if I go back to Penn State, we used to close the shows out with Rolling Stones' Can't Always Get What You Want. And we used to do the extended version. It's like 15 minutes, and I got to play a guitar solo for like 10 of it. So that was still is one of my favorite songs to play, going back to when we jammed in different bars there.
Well, speaking of the different bars at Penn State, what were some of your favorite venues to perform in when you were here?
I think the Cafe 210 for sure. The brewery we enjoyed the first, and then probably among the all-time favorites, the Rathskeller. I don't think it's still there, but I remember there was a lot of ponies being drunk at the Rathskeller, and we played there every Friday, I think, for 2 years straight. And so those are some of the bars, and I don't know which ones are still there or not.
Some of them, the ones you mentioned, are still here. The Rathskeller's here. It's under a different name. It's Doggies now, but still the same kind of Rathskeller environment that you would remember.
Yeah.
How about a favorite class at Penn State?
The thing that I think helped me most was actually in my MBA program there was organizational behavior. They did it really, really well, and how organizations behave, how they think, how you can inspire, how you move them, the important components of that was probably my favorite class. In fact, some of the papers that I wrote for that class are still some that I reference to this day.
How about a recent book you've read or a podcast that you listened to that you would recommend to somebody?
Yeah, I'm reading Frederick Douglass, the Pulitzer Prize, and his life story back then, and I'm not all the way through. It's a pretty thick book, but I'm really, really enjoying it. And I've got some time this summer to get out to a beach, and I'm taking that with me. And it's amazing as one of the greatest Americans that ever lived to be put in the times that he was at, and how he spoke really to what freedom is, not just for African Americans, but what it should represent as an ideal in this country.
What a fascinating, I've read the book. What a fascinating look at his relationship with Abraham Lincoln. And, you know, when you talk about speaking truth to power,
Exactly.
and Frederick Douglass being able to do that at that time, it's fascinating. It's complicated, the relationship. It's really interesting.
Yeah, well, I'm glad you read it, and now you've just empowered me to make sure I get it done in between the meetings that I have.
Absolutely, that was my favorite part. I was an undergraduate history major, and so
Okay.
kind of the Frederick Douglass Abraham Lincoln relationship is really interesting.
Yeah.
If you could have dinner with anyone, who would it be and why?
It would certainly be, without doubt, my father. He passed away 21 years ago on Father's Day, died of multiple myeloma. In fact, the day that he died is when we realized my wife was pregnant with my youngest now. And so there's a lot tied there. But, the thing that I missed this past Father's Day was just, again, going back to barbecues. Nobody could barbecue like him. And, it would be nice to kind of do that together. He liked Michelob for some reason. It was ice cold Michelob with his barbecue. I think that's almost like that would be the perfect dinner right now.
That's great. You've been able to travel with the work that you do. We mentioned, working in St. Thomas, you've traveled the world. What has been your most unusual "we are" moment? Maybe where you heard somebody yell "we are" that caught you by surprise or was unexpected.
Yeah, it actually happened recently, and I have it right here. So you see this? Can you see this, Paul?
Oh yeah, the mask.
Yeah, so when we're all starting to travel again, I was not too long ago, and I'd forgotten that I had that on, and went to LA for the weekend, and in the middle had a group of folks there. I think there's three of them. So we are, and I was sort of like, am I wearing a shirt or something like that? I remember I had the mask, so that's probably a recent experience.
That's great. Your favorite Penn State sport?
Definitely football, but followed closely by wrestling. I wrestled in high school, and we got an awesome team there. So those are sort of one A and one B, if you will.
Well, we're gonna have to have you back up to Happy Valley to go to a wrestling match in Rec Hall. It is when you think of college athletics and the unique environments that there are, right? You think of Cameron Indoor down in North Carolina.
Right.
Rec Hall for wrestling is kind of the mecca of the sport, and so it's
I would love to do that, Paul, because there's something about being at a wrestling match. It's one-on-one. It's a electrifying experience. So, but I've not done that at Rec Hall, so I'm there.
Rec Hall's fantastic. We put 17,000 in the Bryce Jordan Center for a wrestling match every year, and to have 17,000 people go from like a pin drop silence to the loudest eruption you've ever heard in the arena. It's a special experience with Penn State wrestling for sure.
Yeah.
How about your favorite flavor of creamery ice cream?
Peachy Paterno for sure, without doubt. So in fact, I may have to order some. I'm having a little cookout on July 4th. So if that's still there, I haven't been on campus for a while. Then I may have to get a couple of pints.
Peachy Paterno is certainly a favorite. My son Aiden is responsible for shipping over at the creamery, and so get your order in, and we'll ship your Peachy Paterno out for you for the 4th of July.
Seems like you got a special connection there, Paul. I may tap into that.
A little too special. We have too much creamery ice cream at home, but it's you can't say no to it. Gene, I want to thank you for joining us on Coffee Hour this morning. It's when alumni like you allow us to share your story that raises the value and awareness of all Penn State degrees. And for that, we're truly grateful. So thanks for joining us today.
It was wonderful to be with you, and to all my colleagues out there and alumni fellows. It's good to see you, and hopefully see you at a game before too long.
Absolutely. And I want to thank everybody who's tuning in on Facebook Live or here in Zoom. If you're a member of the Penn State Alumni Association, thank you so much for your support. If you're not, what are you waiting for? Go to our website at alumni.psu.edu today, and you can become a member of the world's largest alumni association. Thank you for all you do for the university, for the glory, and for the future. We are
Penn State.